Now, for the mid-sternotomy incision, once again, it's prepped, it's draped, and I'm going to assume that an IABAN drape has been put over this. So once the IABAN drape has been put over this, at that point, we are then going to place our mini square. We're going to place our mini square, usually on the side opposite to the surgeon, which will be on the patient's left-hand side, as close to the midline incision as possible. We'll just mark that. Remember, this has been placed over the IABAN, at which point we then towel off, as we usually do. We have to remember about incisions for the drainage tubes. So that I'll leave up to the surgeon. He may want to angulate this just a little bit if the tubes are to come out over here, but that's not the purpose of this particular training video. At that point, we will then put on the drape, the laparotomy drape. Once the mini square is in position, the thing about the open heart cases is that there is so much material around the table that you usually have to use extension tubing. This is an example of the extension tubing that we have. It does include a filter, a pre-filter, but there isn't much difference other than that. The pre-filter, of course, was originally put on to try to protect the usefulness of the ULPA filter, which is a very expensive part of this, of smoke evacuation. At any rate, let's carry this forward toward the foot of the table, because what will happen now is that the circulator nurse who will receive this part of the mini square tubing will then attach this to the extension tubing. Doesn't take very long. After the extension tubing has been connected to the end of the mini square, and now we may be as much as 10 or 15 feet away from the site of the surgery, the circulator will then come by and hook this up with the ULPA filter. And that, my friends, is an example of what happens when you need additional extension tubing. It will not interfere with the ability to capture the smoke, however. The additional length will not interfere with being able to capture the smoke. So that's the only example that I can think of where extension tubing is uniformly needed because of all the other equipment around the heart surgeon.